We took DNA extraction from stool, from a bottleneck to a backbone, and guess what? That really scaled the way we progressed and how fast everything became. Hi, I'm Kumar Sankaran, the CEO of Leucine Bio. At LRB, we do a lot of microbiome-based research, analysis, and product development around that. Our core product is as a gut microbiome test, which is available pan-India and outside India as well. So we, in 2014, formed the company to do something in preventive healthcare. And at that point of time, heard a lot about the microbiome. I initially thought it was pseudoscience and slowly started believing in it. From there, we've progressed into understanding deep about the microbiome and serving a lot of hospitals and clinics across India. So once somebody orders for the test, we send the kit out to their residence where the fecal sample or the stool sample is collected. It's collected in a small tube which keeps the sample stable for about 30 days under room temperature. From there, through the magic of a few companies, they help us extract DNA from it. And these are microbial DNAs that we are extracting. And that is then put into a next generation sequencing machine which generates the sequences of all the microbes that are there. Initially, before we started our lab, we did a lot of sequencing with the short read technologies out there. But once we started our lab, we've been doing only on the Oxford Nanopore. We did many samples, compared them, short read versus long read, and saw that ONT was giving us much better results. So before we started doing automated stool extraction, it was a manual process. So, get the stool sample, do one sample at a time, and extract the DNA from it. There were two challenges for it. One, it did not give us the ability to scale. So as sample volume increases, the ability to extract DNA quickly and get it into the sequencer was getting a little tough. Secondly, and most importantly, consistency between samples was missing, and that's what pushed us to look for automation. The journey with Cambrian is an interesting one. The team got in touch and they'd come up with this beautiful system called Manta, which helped in DNA extraction. The good thing about Manta is one, it comes with pre-filled cartridges, so you're not wasting time pipetting a lot of the steps. Secondly, there's flexibility of just doing one sample, or we can go up to 32 samples over there. So that flexibility is also there. During manual extraction, we used to waste hours and hours doing the extraction. Now within a few minutes, the DNA is extracted, and we can have multiple runs going on the single day. Secondly, the robustness of Manta is pretty good. That's the machine side. On the people side, they've been really helpful in terms of optimizing the extraction for us, and we're constantly demanding quality of DNA that has never been heard of before, especially in the N50 that we require. And there's been a lot of R&D from Cambrian's end itself to improve the N50 for us, and now it's a fabulous machine that produces great DNA. So at present we're running about thousands of samples every month, 2,000, 3,000, and growing at about 30%, I think, every quarter. This is where automation really helps. But I wouldn't wait till you come to this many number of samples before you get into automation. Any lab, doing even small amount of sequencing, it's more for the consistency of the samples that I would say start early for the automation than for the volume. And of course, when you have volume, it's a no-brainer. You have to get into automation at that point of time, and that's where I'll recommend Manta the most.